Now we have a patient at our hand of intellectual disability, which is basically categorized by the lack of the or the limitations of the intellect as well as the limitations of the adaptive functioning of the individual. When we have such a patient at our hand and when we want to basically manage such a case, first of all, the history taking is again very important, and as well as we have to involve the caregivers or as well as the parental involvement is again very important over here. So the assessment of the patient is again very important. We have to assess and categorize the patient as if he's suffering from a mild, moderate, or a severe form of the disease, and then only we can basically manage or plan a management and a treatment plan which is basically designed for that particular patient whom we are treating at that time. So these are the categories that we'll be discussing over here. Basically, these are the categories of the mental retardation that we're talking about in this section. The categories are obviously that are again very commonly related. For example, we categorize any pathological condition as mild, moderate, or severe depending upon the symptomatology of the individual. The clinical features are assessed, and all of these criteria are again very important whenever we are assessing any psychiatric patient, whether it be a patient of a depression, a patient of anxiety, a patient of phobias. We have to categorize them whether they are suffering from a mild, moderate, or a severe variety, and then only we can decide what can be the treatment plans that can be designed specially and specifically for that particular patient. And so the treatment modalities, they have their basis on these initial assessments. These initial assessments, obviously the criterias are gathered through the initial history taking. When we talk about a psychiatric history, it is very important that we involve the caregivers along with it. An insight should be given to the caregivers as well about the condition of the patient and how are we going to go about treating or managing such a patient. Talking about the intellectual disabilities over here, the IQ is the person's mental age divided by the chronological age, which is multiplied by 100. So basically, this is a formula that is devised for the calculation of the IQ in any particular individual. There are a lot of questionnaires, there are a lot of tests that have been designed to calculate the IQ of a lot of individuals. These tests usually are based on the problem-solving behavior. How can a person basically go about and solve problems? This is again going to tell you about the IQ, which is also the abbreviation for the intelligence quotient. So this is how basically you calculate the intelligence of a particular individual. The performance on a range of problem-solving techniques, they are carried out. There are a lot of mathematical problems, even day-to-day problems, and this is how we assess how a person's mental age is calculated in this particular state. The IQ is basically normally distributed by a mean of 100. So this is how we calculate IQ, and this is basically what we mean when we say the IQ of an individual is 2 standard deviations deprived of, and that is how we categorize that this person has a low IQ. Now, when we talk about the milder forms of the intellectual disability, the IQ is usually 50 to 69, and the mental age of the individual is 9 to 12 years. The basic reading and the writing skills, they are found in these individuals. The speech for everyday purpose is seen in these individuals. They are independent in the self-care, in practical, and even in the domestic skills. The potentially capable of work that is practical than academic. So basically, when we look at these milder forms of intellectual disability, they can be quite helpful to the community if we alter these patients and give them more of the practical work rather than the educational or the academic work. They can basically excel in these practical skills, and this is basically what we have to focus on. This insight should be given even to the caregivers or even to the parents, the siblings, so that they can really know that this person has some sort of an intellectual disability, but still he or she can be proven to be quite helpful to the community as well. So the moderate severity is basically the IQ of 35 to 49. The mental age is of 6 to 9 years old. They are limited in their comprehension, as the use of language is also limited in these individuals, and they need lifelong support in planning and organization of activities. So they cannot be quite independent, as we saw in the milder forms. They were quite independent even in their adaptive functions, but over here in the moderate variety, they need support in the planning of even their day-to-day activities. The personal care depends on the degree of training or even the practice, the cognitive ability, comorbid physical disability, for example. The cerebral palsies are noted in these individuals. There is going to be a complete independent living care, which is basically quite rarely seen in these individuals. They can engage in the simple social activities, and some practical work with supervision can be given to these individuals, and they're usually mobile. So they're not quite dependent, they are not immobile, they can just move about and they can perform their daily basically life activities, but they have to basically be being given some practical work, but the supervision is going to be there. So even they can be proven to be helpful to the society if they are given some practical work and some skills to perform in their daily everyday life. Now, when we talk about the severe intellectual disabilities, the IQs over here are 20 to 4. The mental age basically ranges from 3 to 6 years. They require the lifelong support and assistance, and support in care tasks and communications is also seen. They need support in assessing the community facilities as well as the services. The words and gestures for the basic needs are seen in these individuals as well. They need support for most of the activities along with it. So they have to be supervised all the times. It can be any activities, even their day-to-day activities. The adaptive functioning have to be supervised in these individuals. The motor impairment is quite commonly seen in these individuals, so they can even be immobile and dependent on their caregivers. The profound severity is again very important because they are the most dependent form of the disease. The IQ over here is less than 20 and the mental age is less than 3 years. They are very limited ability to understand and comply with instructions. Mostly they are immobile or poor mobility is seen in these individuals. Little or no ability to care for their own basic needs. They need constant help, support, as well as supervision. So all of these support and help and supervision should be provided by the caregivers or even the parents. The milder intellectual disabilities, when we talk about them, they largely lead an independent life. They know how to budget, they know how to solve their complex problems, and they need supervision and proper education just to be more fruitful to the society and to the community. The range of severity, when we talk about them, the IQ ranges between 50 to 69. We basically describe them as of the milder forms of ID. And the proportion of ID in this group is almost 75%. Then we have the IQ ranging from 35 to 49. They are the basically moderate intellectual disabilities. And the proportion over here is almost 20% of the population. Then we have the IQ ranges from 20 to 34. They are described as suffering from severe intellectual disability, and the population suffering from this severe form is almost 4%. Then we have the profound intellectual disability, where the IQ is less than 20. And the proportion of the population suffering from this profound intellectual disability is almost 1%. So this is the different estimations that have been carried out on the intellectual disabilities. So in this section, basically, we summarized the different categories of mental retardation or intellectual disabilities and how do we go about to manage these different severities. So that is the end of the section. Thank you for watching sqadia.com.